Imagine losing your career, your financial stability, and your closest relationships to the terrifying symptoms of schizophrenia, a diagnosis that you in fact fight against for years because you don't simply want to accept it or the medications that go along with it. However, after multiple relapses, you eventually decide to accept your fate. This is your life, and the medications are necessary. You even launch a YouTube channel sharing your journey of living well with schizophrenia, embracing the importance of acceptance and finding peace within the diagnosis. But fast forward 5 years, your channel has now grown into a massive platform of hundreds of thousands of people, providing hope and solidarity to people with severe mental illness. But then everything changes. You discover something revolutionary. You don't have to actually live with schizophrenia. You can fight it. And through the ketogenic diet, you find that you're able to put your symptoms into remission and actually come off your medications for the first time in years. And the unthinkable has become real. You're thrilled, but also terrified. Is this freedom from symptoms real? Will it last? Have you truly beaten schizophrenia? Amidst the joy, there's also anger. Why didn't any of your doctors tell you this for the years that you were taking those antipsychotic medications, which you told them you didn't want to be on? On top of this, you're also facing another challenge. You're juggling the immense public pressure of shifting your YouTube channel's messaging, one from simple acceptance of the condition to advocating for metabolic therapies and other non-drug options for treating severe mental illness. Critics are calling you dangerous, accusing you of spreading false hope, but your supporters are calling you inspiring. If you want to hear how this very public, controversial recovery from schizophrenia unfolded, you won't want to miss this exclusive interview with Lauren Kennedy West. Lauren, thank you so much for being here. I think a really good place to start is if you could actually just introduce yourself. Tell us about your channel and how you came to be, well known in the mental health space as someone who was living with schizoaffective disorder.
Yeah, so thanks for having me. So my name is Lauren, and I started the YouTube channel originally called Living Well with Schizophrenia around the end of 2018 with my partner, Rob. We just decided that it might be cool to try to reach more people in terms of spreading awareness or even just creating connection for people who are navigating serious mental illnesses like schizophrenia or schizoaffective disorder. Because it's something that just wasn't really talked about a lot. And I think that a lot of people, myself included, felt pretty alone in the experience. And so, we started this channel, I guess it was about 6 years ago now, with that. Are you
like a media person, or were you like a YouTuber before? Like how did this become like the place where you were going to share your story?
Yeah, so I was not. I really didn't even know much about what YouTube even really was. I didn't watch it at all. But my partner had a background in YouTube. He made like photography tutorials and whatnot on YouTube. And so I had been involved in public speaking locally where I live, sharing my story with small groups. And he proposed, you could reach a lot more people if you shared your story on the internet, on YouTube. And so I was super hesitant, but decided to give it a go. And it very, very quickly became evident that it was resonating with a lot of people, and it grew quite rapidly from there.
Were there any hesitations about doing that? Because there's not a lot of people like you out there who can be so vulnerable, talking about something as intimate as mental illness and what the experience is like and the effect it has on your life. What was that like, kind of almost stepping forward and putting that out to the world?
I think I didn't really think it through. I recorded these really intimate and vulnerable videos, but I made the decision to make the thumbnail or profile photo on YouTube one where you couldn't see my face, as if that would conceal my identity or something and people in my life wouldn't know, because very few people in my personal life knew that I was diagnosed with schizoaffective disorder. But the more I went through this process, the more I realized there's tremendous power in terms of leaning into this type of vulnerability, and the connection that it can provide is incredible. And being this vulnerable and, intimately discussing my experience has really allowed me on a personal level to more deeply understand it and to come to terms with it and figure out how to navigate it in the best way for myself. And I hope that talking about it has also provided a bit of that for other people watching too.
I bet for sure. And if you're listening to this now and maybe you haven't heard of Lauren before, but she has I would say it's a big YouTube channel. I mean, there's over 300,000 subs. And I would say it's pretty dedicated community, and there's a lot of engagement on her posts. And so just to give you a sense of the scale of this channel, I actually don't know anyone else out there who's talking about this that has a larger following than you, at least on YouTube. But I want to segue now and actually talk a little bit about your story. So tell us your story. When did you start having mental health problems?
I think I first began to start struggling with my mental health in my late teenage years. It really showed up kind of in high school, I think, mostly. I just kind of really became withdrawn, and I stopped going to classes and stuff. I was always a straight A student and excelled in school, but just kind of really receded. And yeah, it was tough. And I think I first went to a doctor to talk about what felt like symptoms of depression, or what she thought anyway were symptoms of depression, when I was about 18. And that was the first time I was prescribed, I think it was antidepressants she had prescribed me. I don't think I took them because I think I had a lot of like self-stigma around that and didn't think I needed it. And yeah, pushed through another few years. But then in my second university degree program, when I was about 22 or 23-ish, I started to really, really intensely struggle and was dealing with intense feelings of suicide and yeah, just more and more difficulties that I couldn't just keep pushing through. And so I sought out help from the school. There was a school therapist that I initially connected with, and he connected me then with a general practitioner at the school and a psychiatrist. And that kind of began a years-long process of trying different kinds of medication, trying ECT, a couple hospitalizations for some pretty serious attempts on my life, and for manic episodes. And yeah, the psychotic episodes started to come about too. And yeah, it was a really, really intense few years of my life where I just did not understand what was happening with my brain. I felt scared. I felt alone in the experience. And yeah, it was really, really difficult to navigate.
And picking up on that, at the time when all of this was going on, was this something that made sense in terms of stressful things happening in your life? Or was it something that was kind of coming out of the blue? Or was it like a bit of both? How did you understand what was happening to you?
My therapist, when I was like 22 or 23, asked me a couple times, do you think that this is environment or situational, or is this biological? And that confused me so much because I really couldn't pinpoint if there was something in my life that was causing this level of distress or the symptoms that I was experiencing, or if it was just this genetic thing that I was going to, experience regardless. And I still don't really know. I think that I moved away for that degree program. I'm from Alberta in Canada, and I moved across the country to Ontario for school. And I think that was a bit of an isolating experience. But yeah, it's hard for me to really say if it was the situational experience that precipitated these symptoms that I was experiencing, or if it was just going to happen regardless. But yeah, I just really did not understand what was going on. And I really didn't understand, or it felt like there was nothing that I could do to ease it.
Tell us about the journey to acceptance of the diagnosis, because I know you eventually get diagnosed with schizoaffective. What was it like to come to terms with that diagnosis?
I was 25, I think, when I was finally diagnosed with schizoaffective disorder. And, on some level, that felt really good. It felt like a bit of a relief to finally have an explanation for the things that I was experiencing. And it was no longer this feeling of my brain just doing something completely abnormal that there was no explanation for. Now, there kind of was an explanation, but at the same time, there was an intense amount of, I think, mourning or grief around having that label, because then I was also told by a lot of people within the medical system and just the broader societal narrative about what it means to live with an illness like schizoaffective disorder, like schizophrenia. There's really very limited stories about people living well with a type of illness like this. It's very much often focused around limitations or difficulties or kind of almost scary sometimes narratives about what it means to live with this illness. And so getting that diagnosis also then kickstarted a years-long process, maybe even a decade-long process almost, of just trying to figure out how to accept this as a facet of my life and trying to figure out how to decipher what this meant for my life. It took a bit of a different trajectory than I had always hoped or planned my life would. And just really coming to a place of trying to work on acceptance around what it means to live with a chronic mental illness. And I think that this was also a really big goal of our YouTube channel too.
Tell us about those early years. I mean, how had it changed your life? Because, I mean, broad brushstrokes. I mean, you were in college studying, and then all of a sudden you're on medications and getting ECT. Just give us some texture about how your life changed during those years.
So I had gotten my first undergraduate program, and then that year that I started to need help in school was supposed to be a 1 year long after degree program for social work. Mm-hmm. And so what should have taken me 10 months ended up taking me 3 years because I just kept having to withdraw. I was hospitalized and couldn't make classes or just couldn't keep up. And personal relationships kind of fell apart, and I just really withdrew because I was kind of scared of what was going on. I got really lost in feeling really deeply suicidal. And it was just, it was a really, really painful and difficult period of my life to try to navigate.
How did you view medications at that time? I mean, because like you said, initially when antidepressants were offered to you, you were kind of like, maybe not for me. But now later on, you're much sicker at that time. What was your relationship like with the medications then, when you started to become very suicidal and having those problems? Talk us through that.
I think I've always had a kind of somewhat complicated relationship with psychiatric medications. In those first years, it was kind of awful just throwing a bunch of different classes of medication, bunch of different kinds of medication at the symptoms that I was experiencing to try to find some sort of relief. Eventually, we did manage to find some that did appear to help me manage symptoms or dampen them anyway. But, all of these came with a lot of really difficult side effects as well. I think the main one that I really struggled with was just this feeling of blunting of my emotional experience, of the way I could think, and just kind of the way I felt I could show up in the world. But at the same time, I was also being told that these are imperative for me to be taking if I don't want to, be hospitalized all the time. Or, I was told at one point from a psychiatrist during one of my hospitalizations that I should probably spend the rest of my life in the hospital. And so all these narratives really fed into this idea that I have to take these. And I'm irresponsible, or, I'm not taking care of myself if I'm not. But at the same time, I was always aware of these negative impacts that they had on me. And I was also very concerned about long-term side effects that we don't really know much about for a lot of these medications. And so, unfortunately, this did also show up sometimes in some delusional spirals that I would fall into, where when my illness started to get worse and my symptoms were exacerbated, I would kind of fall into this paranoid or delusional spiral of thinking that medications were poisonous or were harming me in some way or were contributing to some form of mind control. And so, I think my deep-rooted fears of these medications kind of came out in symptoms too. And so that was kind of another way that I understood these deep-rooted feelings, or even clinicians understood these deep-rooted feelings as being part of my illness. And so that's been an interesting thing to kind of tease out and process over this last year of thinking about it differently.
Well, I was going to, fast, and I know we're kind of going out of sequence now, but I mean, fast forwarding now, Lauren is now off medications, and she did so with a ketogenic diet, and so far so good. But I mean, a lot of those things that you just mentioned, then about being, the medications are harmful and maybe they're poisoning me in some way. And I know you kind of couched that as delusion, but now you have, at least for now, found a non-drug way to manage your symptoms. I mean, does that still feel like delusion, or does that feel like there was some intuition in those feelings? I mean, medication's a complicated topic, but specifically for you in your circumstances, how do you look back on those thoughts and those feelings from where you are now?
I think with more empathy for, understanding that there was some sort of intuition at play there. But I do also acknowledge and understand that how it played out for me and the decisions I made as a result of those were coming from a bit of a out of touch with reality perspective. But yeah, I think it has been really interesting to think more about how, worries or concerns I had were often dismissed as symptoms of my illness, even when it maybe wasn't completely coming from a delusional or paranoid perspective. And yeah, it's kind of a lot to now try to think about, and to think about it, in a broader context of what this means for, psychiatric patients across the board who are having similar feelings and are often just told, no, that's your illness talking. You have to be on these for life. And yeah. And also while walking this fine line of understanding that there is a place, I feel anyway, for psychiatric medication in terms of helping people manage symptoms and stuff. But I really do think that there is a really big need to kind of reevaluate and kind of reconceptualize how we think about them and make space, I guess, for concerns that are, I think, reasonable.
Yeah. In the early days when, when a lot of doctors were telling you, you may need to be on these for life, you may need to be, in a state hospital, for the rest of your life, things like that. Was that something that you, I mean, the idea of being on medications for life, was that something that you had accepted, that you had come to accept, or was there always, during your whole journey, was there always another part of you that was just like, I'm not sure about this? Like how much acceptance did you have about that? I have schizoaffective disorder, I need to be on medications, because that is the line that I saw a lot during my training and how I was trained to look at these things.
Yeah, I think I had pretty much just about completely accepted that. But, there always was a small part of me that thought, well, maybe I could figure out another way. But I think there was only really one time where I tried, and when I was in a really stable place, I worked with my psychiatrist to try to taper down on my antipsychotic. And I was on lorazepam and had started on, I think, 100 milligrams and had tapered to 80 and then to 80 and then to 60. But when I got to 60, I had pretty intense psychotic symptoms return. And I had to go right back up because my psychiatrist then told me, oh, see, it's your illness returning. It's because you're not on enough medication and you need to get back on it. And so, yeah, that's also kind of been an interesting element of this, is to understand more about tapering and about deprescribing, which is a term I had never heard of even before this last year. And coming to understand that was a quick taper, and that was probably withdrawal-induced psychotic symptoms that were happening because it was a pretty rapid taper. And that was the tapering speed that my psychiatrist was recommending to me. And so also coming to understand from my own experience and hearing from other people that there just is not enough education around deprescribing, because there's this narrative within psychiatric care that that's not possible to go off of these meds. They will need to be on it for life. And so it's just not even a part of the medical education or about, psychiatric practice to understand better what deprescribing looks like or what safe deprescribing looks like.
So I want to move forward to where the crack sort of opens in the door and you start thinking, oh, maybe there's another way. And so I know from 2018 up until I think the end of 2023, you were telling me before we hit record that, the channel's name was really Living Well with Schizophrenia. And it was about acceptance, acceptance of the condition and kind of sharing what it's like to connect with others. But eventually that changes because you start exploring non-drug approaches to try and manage your symptoms and ultimately lower your medications, but actually come off. How did you start thinking about this, about kind of breaking away from this narrative of maybe I need to be on the meds for the rest of my life to I'm going to start to look for other ways to get off? Tell me that story.
So I met my partner in 2018 and I was then hospitalized for a psychotic episode in fall of 2019. And so that was kind of the first time that he really saw or experienced how my illness can affect me in a quite severe way. And after that hospitalization, I kind of felt like, oh, there must be a better way to manage this. And so he took out some books from the library, and one particularly around gut and psychology and mental illness. And it mentioned the keto diet as potentially being effective in managing or treating mental illness. And so we actually first gave keto a try at the beginning of 2020. But we did a very, very bad job of it. And we did not understand it as a proper medical therapeutic intervention. And so we did a lot of things wrong. And then the pandemic hit and our kids were home and it was way too stressful. So we kind of dropped it. But it always kind of remained in the back of our heads because we kept seeing other things pop up around it. And then Dr. Christopher Palmer put out his book, Brain Energy, in, I think it was the fall of 2022. And we were able to interview him on our channel in February of 2023. And digging more into talking with him about his theory about mental illness really being a result of metabolic dysfunction. And so that kind of spurred a renewed interest in digging more into metabolic health as it pertains to mental illness. And eventually in December of 2023, we decided to give it a go, really diving deeply into using ketogenic therapy in the medical context, having a specialist keto coach who could follow me through that and provide guidance around that. And just really diving into doing metabolic therapies in an attempt to manage my illness better. And so we kind of anticipated that, giving that a go for a good 6 months and sharing it in real time on our YouTube channel, because it felt like something that we kind of owed to our audience to let them know what happened, if it was good, bad, whatever happened. And very quickly, it just kind of blew us away. And medication was something that I wasn't even really thinking about in terms of reducing it. I wasn't planning on making any changes at all in my medication until at least about 6 months in, just so that I really knew how this intervention was affecting me, if it would be possible to even start tapering or what that might look like. But even about 3 weeks into using medical keto, I had to reduce my medication because I started to experience potentiation, which I didn't even know was a thing before this either, where I started to experience way more intense side effects of my medication. And that was kind of the first clue that I needed to start reducing. And it's just kind of been a progression from there over the span of 10 months, which is much quicker than I ever thought it would be, if possible at all, to get off of all of my antipsychotic, my psychiatric medication.
Okay, so you did the ketogenic diet for 6 months before you started to taper. Was that right? Yeah.
No. Sorry, that was confusing. So 3 weeks into it, so even in January of 2024 was the first time that I started to reduce because of the potentiation effects that I was experiencing early on. Yeah. So about 3 weeks in, I started to be like intensely sedated. I could hardly get out of bed. And my keto coach was the one who suggested, well, there could be some potentiation going on. And so I went to my psychiatrist and kind of shared that this could be something that's happening. So we decided to try to reduce my medication. And I felt relief, but I still felt a bit of sedation. So the following week, we reduced it again to So I was on the same drug as what I had shared before, lorazepam, that I tried to taper off of. And I started on 100. And so after this experience of potentiation, I was on 60 milligrams, which is where I had experienced psychotic symptoms before. And this time I was feeling the best I ever had and still symptom free.
Wow.
So it's very clear to me through this process that something powerful was happening.
Yeah, you weren't getting worse as you were lowering the drug. You were actually feeling better, which is...
Yeah.
Yeah, okay. Tell me about the rest of the taper. What was it like going from 60 to 0?
Yeah. So again, throughout this year, I've been learning a lot more about perhaps the perils that can come about of deprescribing. And I think I probably went too fast. But going from 60 to 40 then was probably the first time I experienced some withdrawal symptoms after that reduction. I was good for the first week. And then maybe the week after that, I kind of was hit with brain fog. I had a bit of shakes at sometimes. What else was there? Kind of chills and all these difficult things that I think were symptoms of withdrawal. And each time I went down beyond that, it kept getting worse and worse. And I was working with my psychiatrist through all of this. And again, I think there's just not enough information about the possibility of withdrawal. And so I actually even decided to go slower at times than what he was recommending. But in mid-September of this year, 2024, I took my last dose, potentially ever. I'm not sure. We'll see. But for now, of my antipsychotic. And that withdrawal experience was probably definitely the worst. I went from 10 milligrams to nothing, which is probably, again, way too drastic of a I know. I've watched other things from you and I was anticipating that response from you. And I wouldn't recommend that. But I was able to push through the withdrawal. It probably lasted like 2.5 months, 2 months maybe, of kind of, having to push through those withdrawal symptoms. But I think I'm out of it now and feeling really like the best I ever have.
Could you contrast, like, how do you feel on a daily basis now compared to, I guess, before you started keto? You know, when you were, before you started keto, what difference do you notice in your life?
I think I was kind of blown away by the change in experience because I thought that I was quite stable and living well with schizophrenia. You know, that's kind of the way I approached my illness. But going through this last year, I think has really opened my eyes to how much I was affected by the medication. And, you know, it's hard to say because I simultaneously perhaps improved symptoms of my mental illness through keto, and I went down on medications that may have also been affecting me in somewhat negative ways. And so it's hard to really pinpoint why these are happening, but it is quite astounding how my capacity has increased, my range of emotion and ability to perceive and show up in my life, you know, has just really improved. I don't experience any symptoms of my schizoaffective disorder, which is also wonderful and freeing in a way. But I just feel more connected with how I want to experience my life. And I think I really, in the process of going down on my medications, became more aware again of how these medications had been impacting me and how I had just kind of become habituated to that feeling of blunting or that feeling of, just a general blunting and reduced cognitive functioning and all these things that I didn't even realize I was experiencing because I had been on them for a decade and I just got habituated to it. And so taking that away, really opened my eyes to it.
It's kind of, I mean, that can be scary. And a lot of people say that And I even experienced that when I was taking Xanax after my daughter was born, and I started taking it every night for sleep problems. And eventually I started developing obsessive thoughts. And it's just, I mean, sometimes these effects can just creep in, even if the drug was helpful at the start. And so I've experienced that, and I've also hear that from a lot of people, that when they come off, it's like I didn't even realize the effects that these medications were having. Just to get a time frame here, how long were you on antipsychotic medications for? It sounds like you kind of started maybe in your mid-20s. Like, how long was that period of time?
Yeah, I think the first time I was put on an antipsychotic was when I was maybe 23. I'm now 33. So about a decade of taking antipsychotics. And that was various types of oral antipsychotics. I've been on the injections, depots of antipsychotics. Yeah. And also oftentimes prescribed alongside other medications like mood stabilizers and anxiety medications, other medications to counteract side effects of these medications. And polypharmacy has been a component at times as well.
I have a good friend called Trudy. We actually worked together in the taper clinic, and she came off. She had a bipolar diagnosis and was getting ECT and antipsychotics for like 2 decades, essentially. And she came off right about when she turned 40. And she talks about, like, she doesn't say it in this way, but I paraphrase it. I mean, it's almost like you're a different. She felt like she was a different person in some ways on the medications, like that the personality was different, like the blunting made her see things differently. And then there was almost like the life, it was like almost waking up from a dream in some ways, she would say, when she came off the medication, and she's kind of looking back at her old self and kind of like the life and the decisions that she made, almost as if it was a different person. I mean, have you experienced anything like that, where you kind of, now where you are, you're feeling different, and you're kind of like what happened, or like, I don't, how do you relate to your medicated self now, looking back at her?
I think there has been some mourning happening, or grief around maybe even years lost, in terms of wading through pretty intense struggle with navigating this illness and how it affected the way I was able to show up in my life, the trajectory of my life. And kind of getting lost a bit in the feeling of, what could my life have been like had I discovered this intervention way earlier? But at the same time, I think that, suffering is a component of the human experience. And if it wasn't this, it likely would have been something else. And I do feel like I learned a lot about myself through this process. And so, in that regard, I think I'm coming to a place where I'm okay with it. I'm okay with who I felt I was, through those years, and what I'm stepping into now. But there is an interesting element, I think, of going through this experience, kind of more from a societal perspective, where I think that mental illness often becomes really enmeshed in someone's identity. Comparatively to other chronic illnesses, where it's really more something that is, kind of happening to your body or whatnot, whereas mental illness really becomes part of who you are a lot of the times. And so there is the kind of that interesting element of kind of stepping into this new experience of not really dealing with my illness anymore, and kind of being like, oh my goodness, who am I now? Or even, the how we've been publicly sharing this throughout the last year, I think has kind of been challenging, or even feeling a little bit threatening to people watching who also identify strongly with their illness. And it's kind of been a really interesting element too of this, in terms of challenges that are happening with this new proposition of what is possible in terms of recovery, ultimately challenging our collective identity of what it means to have a chronic mental illness.
And just to clarify, I mean, what stuck out to me when you were saying that, I was just like imagining, I mean, if you're in this state where a doctor is telling you need to be on medications for the rest of your life, and there is some blunting and there's some cognitive slowing, you might think your potential is here. You know, this is kind of all I'm going to achieve. But then when you come off, I mean, it kind of blows the lid off that. And it's like, well, who knows? You know, maybe I could do other things now that I couldn't do before. Is that kind of the feeling of kind of busting out of that old identity, or maybe you can elaborate on it in some way?
Yeah. I think kind of as mental health patients, there is often this perception that there is a limitation on what is going to be possible for your life, especially if you are living with a serious condition, schizophrenia, bipolar, those types of illnesses that are really thought to kind of impair what can be possible in terms of your life. And part of, I think, what it's come to mean to be a mental health patient in that regard is to just kind of accept that and to kind of succumb to the fact that there is going to be a degree of struggle or suffering just kind of built into your life as a result of living with this illness. And stepping into this kind of new understanding that that is not actually true. You know, there is still room and space for people who may be navigating these illnesses to step into thriving, whatever that may mean for them, you know, like that is possible. And so I think that maybe sometimes people are getting a little bit hung up in terms of what we've presented on the channel over this last year as being this message that keto and metabolic therapies are how you achieve recovery. But I think that is missing what we kind of need to dig into more deeply as a collective community of just kind of reimagining what we're aiming for. It doesn't need to just be, I'm aiming to dampen my symptoms and that's as high as I'm going to aim. We can move that bar to be much higher to figure out, how do I enjoy my life? How do I find this state of thriving, whatever that may look like for me? Because we deserve that. And it is possible. Maybe not in the way that we've traditionally approached it, which is really just to throw medication at it. And that's not to say that there's no room for medication in terms of achieving those goals, but it does need to be a much broader perspective in terms of what we look at and what we consider working toward those goals.
Do you get kind of pissed off when you think back to kind of how this was all framed for you when you got the diagnosis and the medications?
I think I have gone through some phases and bouts of anger.
Yeah.
But I think I can let that go in terms of understanding that doctors, the system, were operating with the information they had at that time. I think where I get pissed off or angry now is when this is coming into our, understanding, our collective consciousness about, important to consider in terms of moving the needle to be more helping patients thrive. These ideas are coming into play. And when there is a rigidity or a resistance to being open to that, I think that is when I feel anger now, because I think that, the medical profession has kind of a responsibility to remain open to new information or to, feedback in terms of how to improve practice or how to improve how they're able to support their patients. And likewise, the resistance from patients in terms of not wanting to step into this role of feeling empowered in terms of taking more ownership over their own health and well-being is kind of a difficult thing to navigate too, because I do think that that is also a big piece of the puzzle that has traditionally, within traditional psychiatry, just not really, there hasn't been a lot of space for that, for the patient to really direct their own care or take more ownership over it. I mentioned in a video recently this idea that I even had for a long time navigating mental health care of feeling or maybe hoping that your doctor or the psychiatric system is going to save you or pull you out of the difficulty that you're facing. And oftentimes I felt anyway, like I was just trying to make it through and survive until my next psychiatrist appointment, with the hope that that would be what pulled me out and saved me. And I don't think I'm alone in that experience as a mental health patient.
I think it's really, I think it can be really reassuring to have that understanding of your symptoms, to be like, these are from a brain illness and my psychiatrist is going to fix it, because the reality is so much more complicated than that. I mean, it could be, it could be complicated things going on in your relationships, in your life, in a career that you hate. It could be medical problems that are being missed. It could be things that could be fixed with nutritional problems. I mean, the things that cause mental health symptoms are so complicated and varied. And some of them you just can't fix. I mean, there is a certain amount of anxiety and depression that just comes from kind of really hard to solve problems, just like poverty, and homelessness and things like, and sometimes the problems are just overwhelming. And so it's a lot easier and more comforting to say, well, it's a mental illness and don't worry, the solution is the medication. And I think that can be very alluring.
Yeah. And I don't want this idea of like putting the onus on the patient to take ownership over this to kind of be like putting the blame on the individual, because you're right. There are like systemic issues like poverty or, other socioeconomic factors that really impact this that sometimes are just kind of out of an individual's control. But I think that there does need to be this kind of individual understanding at the very least, or awareness of these other factors that need to be acknowledged. At the very least, it's never just going to be as simple as taking a pill to pull you out of the complexities of the human experience.
Mm-hmm. And I mean, I think the area that everyone should be pretty pissed off about is the fact that we've built a healthcare system that is so good at dishing out medications and seeing, 4 people and, in 1 hour, instead of building a really nice system that can break down complicated problems into step-by-step things that can be more hopeful, that can help patients in a better way, whether it's taking something like a paleo style diet and making that accessible, and making some dietary things covered by insurance, and having some great coaches out there and some programs. So these big, complicated, overwhelming things, whether it's how to have better relationships, or how to find more meaning in your work, or things with your diet. I mean, there are ways to make these non-drug interventions more accessible to people, and we don't do it. We don't, and you just go, well, where are the doctors? And you see them, and it's just medication based. But there's all of these amazing things that we can do for our patients, but the medical profession is not doing that. And then you're just like, well, where is the leadership? And you look at psychiatry and you go, there's like, are people asleep at the wheel over here, or are they just kind of interested in this one intervention? Because, from my vantage point, we help people come off the drugs now. So we're using all of this non-drug stuff to help people, and gosh, it works. And I think people should be pissed that the healthcare system that they have is just emphasizing, medications and kind of quick visits, rather than kind of meeting the person where they are and being like, okay, how do we get you the result that you want, which is really to thrive and to do well, and hopefully to do it on no medications or as little as possible. We're not doing that. I feel like we're focused on efficiency rather than the result for the patient. And I think everyone should be upset about that, because that's not the care that we'd want for people that we love.
Yeah. And I think when you start to even take a step back and see, well, why is there this fixation on this? You could get into the influence that like pharmaceutical companies have on promoting this. And I don't know if we'll get too much into that, but
let's stay there, because you were living well with schizophrenia. You were the channel that was kind of about accepting, that there may need to be medications and you may need to accept the limitations. And now you've kind of, I don't know if it was the red pill or the blue pill. Let's just say it's the red pill. You've kind of, gone down the rabbit hole, or you've taken the red pill. What is it like now? Because I think naturally once you come off the medications, you start to question a lot of the things that you have been told, and maybe you find other stories like yourself. It's kind of eye-opening in a way, and kind of shocking if you've been in this one narrative and then you're just like, well, actually, there's a lot of other things going on. What has that experience been like for you, kind of waking up to this other side?
It's hard. When you start to have a better understanding or a different perspective, I guess, on why these systems are the way they are and why they're perhaps missing a big piece of the puzzle or missing the mark entirely in some ways. And yeah, like on the topic of pharmaceutical companies being a big player in terms of, pumping medication as the primary method of treatment or the only method of treatment oftentimes. I heard you talk about this in your interview with Brett Scher on Metabolic Mind, where you kind of pointed out that these like RCTs done by drug companies are essentially marketing campaigns. Sorry if I'm misquoting that, and we recently did a video on Cobenfy, the new antipsychotic being released, and kind of dug into how it's really being framed from a marketing perspective as this like game-changing drug that's going to like vastly improve the experience for people living with schizophrenia. But when you actually dig into the results of these trials, they're not that much more effective than any other medication. There's tons of side effects, and like, yeah, it's using a different pathway, and that's exciting, I guess, in terms of progression of science or understanding maybe of how these drugs are working. But yeah, it was quite interesting to see how it is being promoted in the broader psychiatric narrative in terms of really getting people to think that this is the most effective way. Yeah.
I know. Yeah. I mean, hey, it was news to me as well. And I only really realized, the limitations of the psychiatric research after being at the FDA and working in the drug companies for a couple of years, and how there's just massive gaps, especially when it comes to the long-term use, about just how effective they are over time. But let's shift gears, because I know I'm going to interview with you right after this one, and we can talk all about these issues then. But I want to talk about your experience in the shift of your channel. I mean, because you've had you were the Living Well with Schizophrenia channel about acceptance of the condition and the role of medication. And now you've shifted to Living Well After Schizophrenia, which is, the content that you're making almost has a different audience now. I mean, the audience has kind of changed. And I read the comments on your videos because there's been kind of some turbulence over there. So I wanted to talk to you a little bit about what it has been like for you to, for someone who has a 300,000 person subscriber following, to get to the point to say, well, actually, I don't think I need meds anymore, and I don't think kind of accepting that meds were the way. Are the only way worked for me, and I actually think there's other ways to thrive. What has that shift been like for your channel?
I think I was really surprised initially when I started, or when we even announced that we were going to be trying this. And when I started to share about the benefits I was experiencing, I was really, really surprised that there was almost it seemed like this 50-50 divide in terms of positivity and support, and the other side being a lot of negativity, borderline hate, and calling it dangerous, really, what we were doing, and feeling like I was harming the community. And that was really, really difficult to navigate for a long time. And it's something that I've really tried to be mindful of throughout this whole process, because I don't really want the audience to just shift to people who are open to metabolic therapies and whatnot, alternative ways of managing mental illness, because I really do want to be able to reach everyone within the community and everyone who has engaged with our content over the years, because I feel like this is the future of psychiatry, shifting the perspective, the way we are talking about. And so, yeah, we've really been trying to be mindful of like, what is feeling threatening here, and trying to figure out how to work through that with our audience.
Can you share?
Because you know what
some of that, like, I just want to jump in. Like, what do you think has been threatening for those who are telling you that what you're saying is dangerous, and kind of almost shaming you in a way for doing? How do you understand that person?
So, you know, part of this has been understanding that, yeah, like part of that is true. It could be a little bit dangerous in terms of understanding that many people who watch our channel are part of a bit more of a vulnerable community in terms of probably dealing with stuff that I talked about dealing with before around delusions around medication, or just wanting to completely go off medication cold turkey or that sort of thing, and being a little bit more susceptible to not handling that in the safest way based off of suggestion that is working for someone else. And so understanding that that is a factor here, have really tried to be very intentional about, you know, encouraging, making it as safe a thing as possible, working with your care team, understanding that some people may need medication, and that's okay too. But I think like kind of what we were talking about earlier too, of this perceived challenge or even threat to people's identity of what it means to live with a mental illness is really being challenged and kind of confronted through a lot of the content that we're putting out. And so kind of trying to work through that, and trying to, like I said, again, shift the conversation to be one around getting people to reflect, even just start with reflecting on what their current quality of life is. And then asking themselves, am I happy with that? Do I want more? As kind of this gateway, hopefully, to opening up to various other options or ways to work toward the ultimate goal of figuring out how to thrive.
Mm-hmm. What do you think is so scary about questioning the identity, and opening yourself up to other ways of, I don't know, maybe the hope of change? What do you imagine is scary about that?
I mean, even just that like hope element can be a scary thing for people who have navigated a chronic mental illness, because, you know, at various points of navigating this illness, you have hope that, you know, your circumstances will change, your symptoms will improve, your life will improve. And oftentimes navigating the traditional psychiatric care model and system, that just doesn't really happen. And you get a little bit worn down and maybe even disillusioned about it all. And so it almost can feel scary to open yourself up to hope, because what if it doesn't work for me and then I'm crushed all over again? But in terms of that, yeah, but, you know, also in terms of the identity piece, I think that having these limitations as a result of navigating really difficult and oftentimes debilitating symptoms, again, really does inevitably become really enmeshed in how you view yourself and how you view who you are, or even how other people view who you are. And if all of a sudden there's this prospect that doesn't have to be a part of who you are, you could recover, you could go into remission. Sometimes I think that doesn't necessarily feel like a good thing, because it's removing a part of who they've come to understand themselves to be. And that's hard to understand from someone who maybe doesn't experience it or hasn't enmeshed it with their own identity, because it feels like an obviously really good thing to not have to experience debilitating and distressing symptoms of a mental illness. But again, it's so weird with mental illness how it really enmeshes itself into identity.
What's the emotional load been like for you to kind of be at the epicenter of this of this big change that's happened in your channel? And I mean, you strike me as someone who's very empathetic, who really cares deeply about the audience. What's that been like for you to kind of weather this storm?
It's been really difficult at times.
Yeah.
Yeah. Especially dealing with when people are feeling like I'm harming the community because I've really dedicated basically my life at this point to trying to support the community. And that's really where I'm coming from with this project that we've been sharing over the last year too. And yeah, it's really difficult to hear that people feel like I'm causing harm, or to, shoulder a lot of the difficult feelings that people are working through. But I think, just trying to understand this as, change is hard. And especially when you're asking people it's really like a big paradigm shift, how we're looking at mental health, how we're looking at mental illness, how we're looking at psychiatric care. And I understand that is a difficult thing to wrap our heads around. It's been difficult for me to wrap my own head around. So having empathy for how that difficulty is coming out from our audience, I think is important.
And I'm reflecting on it now. I was just going to say, I'm reflecting on it now.
Oh.
Yeah. No, I'll let you go. You go, Lauren, and then I'll go.
I was just going to speculate that you probably have a similar experience in terms of being a psychiatrist who is also asking for kind of a shift in how we understand this very huge component of psychiatric care. I'm sure you're kind of navigating a lot of that too. And I get the sense that you were also an empathic person coming at this from a place of wanting to help improve the system and help improve patients' lives. And I imagine you get your own backlash.
I do. I get a lot of backlash on Twitter. But you're making me reflect a little bit on it, because this is clearly a complicated topic coming off medications, and it's clearly dangerous as well. And I think it's one, because I think people have tried to come off medications in the past, and sometimes when they've come off, they end up in a psychiatric hospital and completely derails their life. And sometimes you're picking it back up for months. You strain your personal relationships. You might lose money. And so you may get to a point where you're just like, that's just too dangerous. And so if you've had that experience and you don't get the support, it makes sense that hey, this is kind of dangerous, at least in my situation. This really made things worse for me. And then there's that other, I guess that part of, I think part of accepting that you have a mental illness also in a way shields you from hurt, because I think in the early days, you're like, well, maybe this is a once off, maybe I can come off, maybe I don't need to be on this for a long time. And you have all these hopes and these expectations. And if you don't get better, they get dashed. And then to shield yourself from continually being disappointed, you want to accept that. And then, and that's could also be a really painful journey for a person. And so to open yourself up again to this hope, it could almost just hurt you again, deeply if it doesn't work out. And so I get it. I mean, what we're talking about isn't an easy journey, and it is a journey fraught with risk, unless, and which hopefully now can be minimized, because there's a lot more people doing this good work and who can guide you, but it can be a dangerous risk without the right help. And so I do see that side of it as well. Yeah. Well, Lauren, for people who have loved what you've had to say today, do you work with people? Do you have any products or offerings or anything like that? How can people work with you or support you if they want to do that?
Yes, follow along on our YouTube channel, but we also have a couple peer support communities, which I'm really excited about. So we've had one for a few years now that is geared more toward people who are navigating a schizophrenia spectrum illness. So you can join that online peer support community, but we just started a new one a couple months ago that is geared specifically for people who are interested in using metabolic therapies for various types of mental disorders. And so it's really developing into this really cool place where people who are trying to use these interventions to improve their experience of their mental illness can kind of come together and share feedback, share encouragement, share support for things that are going well, things that they're finding challenging. And like you said, there's not a lot of professionals. There are becoming more and more, but it's there's kind of this necessary element of people kind of taking ownership over it a little bit at this point in time. And so it is a really cool way for people to connect with other people who are navigating it too. Cool.
Lauren, is there anything I didn't ask you about which you think is would be interesting for my audience?
I don't know, but maybe I would direct everyone to the YouTube channel Metabolic Mind too. They have a really awesome collection of videos to learn more about implementing ketogenic therapy and metabolic therapies. So yeah, that's kind of an additional resource on top of following my journey on our channel.
Well, Lauren, thank you so much for coming on. You are an inspiration. Looking forward to speaking with you on your channel right now. Yeah.
All right. Thank you for having me.
Yeah. If you found this interview inspiring and you're looking for more hope, you won't want to miss this interview with the Harvard-educated lawyer, Jim Gottstein, who recovered from his bipolar illness without medications.